I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thank you for joining us for today's procedure. Our guests are Doctors Ernestine Wright and Jonathan Rich of Mercy Personal Physicians in downtown Baltimore. So Dr. Rich, we'll start with you. Where are you from originally?
I am from New Jersey.
New Jersey?
Yeah. Right up the road.
So when did you come to Maryland?
I came to Maryland in 2005. I went to medical school in Missouri, which coming from New Jersey was very exotic. But it was a great trip. It was a great school. And then I did my residency in Detroit. And I had been selected for a National Health Service Corps scholarship, or I applied for that and was selected for it. So after finishing residency, I had to go to an underserved community where they didn't have primary care physicians, and we chose North Carolina. So we were there for 4 years, and then we were able to choose wherever we wanted to go, and my brother-in-law lived close by in DC, and we liked the idea of a small city that had everything in it, and looked at Baltimore and ended up here in 2005.
And when did you join the Mercy Group?
So I was when I first came up here, the doctor I was with was on staff at Mercy, so I got my staff privileges at Mercy and admitted patients to Mercy. So 2005, I was coming to Mercy, working in the hospital, and then in 2007, I actually started my practice under Mercy. So since then.
Dr. Wright, in a recent interview with WBAL's Lacey Griffith, she complimented you on your English accent. You are from Manchester, correct?
That's correct.
Now, how did you happen to pop over the pond and come to the U.S.?
Well, at a young age, at age 23, my then fiance suddenly died of meningococcal meningitis, and it was a difficult time. I questioned whether or not I really wanted to continue being a physician. Around that time, a friend of mine was traveling to London because she wanted to come over to the U.S. to work as a physician, and she asked me if I would just go along. But she didn't want to travel to London on her own. So we went to the recruitment fair, and I just stood by a window gazing outside, and a gentleman came up and started talking to me about being a physician and the difficulties and sacrifices that one had to make as a physician. And so then we talked, and then he just asked if he could keep in touch, and I said that was fine. Well, I realized a month later when he wrote to me that he was the director of the residency program at West Penn Hospital in Pittsburgh, and he invited me to join his residency program, said that he thought that would be a great fit for the team and that he had enjoyed talking with me. And the rest is history.
Now, why did you both choose medicine? I mean, was that something you always wanted to be? Like, since I was 4 years old, I wanted to do it, or you had no clue you were going to wind up as doctors?
Yeah, I was not that far seeing in ahead. I knew it took me a little while in college to figure out I wanted to go to medical school, but then when I did, I was very focused on it. And then getting to medical school, I realized I liked a little bit of everything. I didn't want to just do one thing. So after, I think, even a year or two of medical school, I was pretty clear that I wanted to do primary care. And in primary care, there are only a few tracks you can go: family practice, internal medicine. GYN is also considered primary care. And so I didn't necessarily want to take care of children or pregnant women, so that pretty much left internal medicine. And so, I was made my decision. And then that, coupled with the National Health Service Corps scholarship, which I had to decide before going to medical school, I pretty much was committed before medical school to have to do a primary care specialty, because to get that scholarship, that's what you needed. But I was pretty sure I was going to do that, and then going to medical school confirmed that, so it worked out great.
Mm. How about you, doctor?
Well, I think growing up, I always knew I wanted to help people. I remember when I was in school, I guess in high school, I had this fantasy that I was going to become a dentist, and I'd have this grand waiting room that would have rabbits in it, and I also have a vivid imagination. But then my grandfather was diagnosed with colon cancer, and he was metastatic. So we spent a lot of time helping, looking after him and just watching him deteriorate because he didn't respond very well to treatment. So I think at that time, that's when I decided I wanted to go to medical school to become a physician. And he actually passed away during my first year in medical school.
Now, when we first met, you were serving as medical director for Stella Maris, Central Maryland's largest long-term geriatric care facility, and has a relationship with Mercy. What was your experience like there, and how did what you learned there impact your practice of medicine now?
Well, I am a geriatrician as well as an internal medicine specialist. And so working with the elderly at Stella Maris and at Mercy Ridge was something that I wanted to do. Working in the field of geriatrics, you have a lot more time to talk to patients, to get to know them. I heard a lot of stories about their families, about their experiences. Some of them are war veterans. I think the biggest thing I learned at Stella Maris and Mercy Ridge is that you should never really judge a patient by appearances because you never really know the story behind the person that you see. And that I always wanted to be an advocate for patients. And so I think I was well placed there because I was able to be their voice. And they became part of my family. I think that as a geriatrician, I was a lot closer in some ways to patients because, my children used to visit them, and like on Saturdays, we would bake cookies and just go and visit them. And they were more an intricate part of the family than I would say my patients are now, because the setting in the office is different.
Now, Dr. Rich, you mentioned a couple of times your work in community care. You had the National Health Service Corps Scholarship. And this allowed you to pursue this interest in rural North Carolina.
Yeah, it was an interesting time.
So tell us about that a little.
Yeah, it was, when I applied for the National Health Service Corps Scholarship, I knew I wanted to be helping people who maybe didn't get everything they needed. And so I was like, this is a great fit. I want to do something for people, and I could get paid for it to pay for medical school. It's a win-win situation. So I went to rural North Carolina, and they didn't have a lot of medical providers, but there was a hospital and there was a very strong community there, Native American, African American as well. And so I would actually do a lot of community events down there, give lectures, go to health screenings. And then initially when I came up here, actually still was doing that. As my practice has gotten busier, there's unfortunately just not the time to do that. But getting out in the community has been one of the things I've really enjoyed doing. We would go to different groups. I remember speaking to one of the Native American groups, and they made me an honorary member of their tribe, which was very, nice to have. But yeah, no, it's just being part of the people, hearing their stories, getting to know them, and then advocating for them when maybe they wouldn't get that elsewhere.
We'll take a break and be back with the next segment of Medoscopy.
Tonight's Woman's Doctor, have you taken a close look at your fingernails?
Well, if something looks a little bit off, you may want to talk with your doctor. Dr. Ernestine Wright at Mercy Medical Center says there could be several things going on. If your fingernails look pale, it could be a sign of iron deficiency. If you have vertical ridges on your fingernails, Dr. Wright says that could be just because of your age or possibly a zinc deficiency. It may also be an underlying health condition like thyroid disease.
We sometimes look for horizontal ridges. Those are ridges that are across the nail bed, and those can be a sign of a more serious disease that caused a change in the way the cells that form the nail bed work. And that could occur if, say, someone was having chemotherapy, or someone had a severe illness like a pneumonia or even severe COVID.
Well, if you always have your nails painted, Dr. Wright says it's really important to take a close look at what they look like once that polish is removed.
something we should all think about year-round: sunburn, and not just from excess sun exposure. Certain medications can make you more sun-sensitive, and it may not take long to burn your skin. And that's tonight's Woman's Doctor. Mercy Medical Center Dr. Jonathan Rich says staying out of the sun isn't realistic for most of us, so you need to take the precautions and know if your medications can make you more prone to sunburn. And he says there are many of them.
Probably the most common ones we'll see will be antibiotics. Of course, some skincare or acne medications will do it. Some of the common anti-inflammatory medicines will do it. Some birth control will do it. So it's a pretty big list. So, definitely check with either your pharmacist or your provider to see if there's something that you might need to be aware of.
You can also check the possible side effect information that comes with your medication. And one more thing, Dr. Rich says, the chemical reaction to the sun can also present itself like an allergy or almost look like poison ivy and may appear on areas of the body not directly exposed to the sun.
And we're back. As frequent viewers know, one regular feature of our program is a sort of show and tell, where guests bring in something, some item, could be a book, could be a photograph, who knows what. But in some way, it's important to them, symbolic of who they are and what they're about. Dr. Wright, what did you bring with you today?
Well, I have two items. I love indoor gardening. Everybody who knows me knows I love my plants. I cherish them, and in fact, my family always tease if I'm going away for a few days and tell my plants, well, she's going away, so now you have to deal with us. I also love flowers and love making flower arrangements, but of course, in the office, because of the scare of allergies, I've sort of gotten into making artificial flower arrangements. I do the flower arrangements for my church as well, so I think it's a nice outlet. And
So are these live or artificial?
these are artificial.
Oh, they get so good now, it's very difficult to even tell sometimes.
Absolutely.
Oh, that's cool. Dr. Rich, what'd you bring?
I brought my spatula because I like cooking. I was going to bring my chef knife, which I really like and I use the most, but I didn't want to tote that around the hospital. I didn't think that was a good idea. So the spatula was good. But no, whenever I have a little time, I love cooking, doing new recipes. Most importantly, I like eating, but most importantly, it connects me with my family. I think I cook for my family and for my people, and it helps us connect. And my kids are now cooking, so it's just a great way to connect with people. So that's where I love doing it.
What do you like to cook specifically?
I'll cook whatever, I get my little New York Times app, and whenever the new recipes come in, I'll pick out one that I think everyone's going to eat and, make something. We made like a mushroom parmesan last night, and, whenever I have time.
But do you have favorite recipes or things that you've made your own? In other words, what are you known for?
Yeah, well, I have the traditional stuff that I make for my kids, a brisket or a roast chicken, that's the classic, classic foods, which when the kids are away from college and come home, I'll make sure I make them one of their favorite dishes. Apple cider chicken, that's one of the ones they like too.
So when you use the chef knife, do you get to feel like, oh, this is where I can kind of be a surgeon?
Great. Oh, I love it. Yeah, I get to, when I'm breaking up a chicken, it's like, you get to dissect it. Yeah, but I never would be a surgeon. Too much blood. Fortunately, there was no blood afterwards.
We'll take a break and be back with the next segment of Medoscopy.